just my funding and my support. If I didn't have that, I probably would drop the program.
It's a lot harder when you have to pay out of your pocket and stuff and work full-time and go to school full-time. Like right now I'm only working part-time, but it's just because I got the funding from Next Steps. It helps me not have to worry about that part.
American Indians in North Dakota and the surrounding states continue to experience major health disparities. In fact, this region has the shortest average lifespan of American Indians in the U.S. And while research-based causes have not been established, many believe this gross disparity is due to inadequate health care. Across the United States, there is a large need for skilled American Indian nurses, and that is most evident in North Dakota. Compounding this issue are the significant healthcare needs of tribal populations throughout the state, and the preference of American Indian patients is to be cared for by those who share similar culture and values.
Deep breath.
We have to train people to take care of our people. That's what I want.
Next Steps is a 5-year grant that provides opportunities for American Indians in North Dakota to access an educational pathway leading to careers in health professions. Its goal is to create a career ladder, allowing entry and promoting advancement within the healthcare workforce through a variety of educational options. The Next Steps project provides services to students in North Dakota. These services include mentoring and financial assistance.
The biggest thing that our students are utilizing right now would be the daycare. I can think of one student specifically. If we weren't there, her bill would be like at least $1,300 a month.
Some of these people don't have a whole lot of resources, and so we help them as best we can.
I chose nursing after having to care for my grandma. She had lung cancer. Being in the nursing home, I want to be that person that you can trust your grandma to or your mom.
My mother had passed away, and it just kind of, I looked at my children and I wanted to be like a role model to them and to try to continue on with, to go back to school and continue on and show them education is really important.
It was like a 45-minute drive, and there's limited daycare on Standing Rock, and so finding daycare, finding ways to get to class, that was my biggest struggle my first semester.
Sometimes I wish that I would have went to school before I had kids, because I have to put them ahead, make sure they're taken care of before I can start my studies. So it's usually about like 8 o'clock in the evening on when I can start doing my homework.
I'm the mother of 3 young kids, so trying to work around their schedule and then have my own schedule now, it's been a challenge in itself.
I came 3 days before classes started, and it was one of the worst mistakes I could have ever made. Nobody told me that you're supposed to read your syllabus, you're supposed to have this done because you're gonna have a test the next day, literally. So that was a big challenge, and I still had everything in boxes. We had an air mattress on the floor. I had my daughter. She didn't start school for a week. I didn't have childcare set up.
Like the underclassmen, I try to give them ideas, just like little tricks that helped me get through some of the classes. I'm always telling them that I'm here.
My family continues to be my ultimate support system. There's times when I can't attend family functions because there are school priorities, but they understand. And it's hard to have to miss those times when I know everyone's together at grandma's and I'm not there, I'm here in Bismarck, but I know that ultimately I'm doing something that is going to be good for all of us.
Our class, we're all pretty close, and whenever something goes wrong, like right now my car's actually broke down, but my classmates have all helped me out by giving me rides.
Whenever I'm having troubles and just want to quit, I call up my mom and she's like, you're almost done, you're almost done. And then my classmates, we talk about everything.
I think it was my kids that give me encouragement because I want a better life for them,
and especially I take a lot of pride in my culture, and I'm proud to be an Anishinaabe Ikwe, and that means an Indian woman, an Ojibwe. And I don't know, I believe in leaving a legacy, and I want my kids to never think that they're not smart enough. Because I went through that phase, and I feel like I could take on the world. Because I got this far, and there's no looking back.
Oh, it helps me a lot. Tuition, gas to get to school, then the mentoring, the study sessions, help with getting homework done, and like just the push to get through.
I was paying my own childcare. They helped me with childcare. They helped with like the gas vouchers for going to school. When we're up at clinicals, they help with the meals, and biggest thing is the childcare, like paying that out of my own pocket and making sure that I had someone for my son was the biggest of all. Yeah, and I think if it wasn't for them, I don't know if I'd continue on after my LPN, because that's the whole thing I'm worried about is funding.
Their help with paying my tuition and my books, because like I said, I have 4 girls and they're not cheap at all.
I have my mentors through the Next Steps program. Once I knew I had them on my side, or they're just there for me, I felt really supported and just really happy. A lot of the anxiety of everything went away.
Just having an open door, with really any needs, or just to talk, and then the tutoring really helps to have that to go to, that set time to, instead of being at home and being like, oh, I'm gonna study, or having that set time for some place to go and other people to be there to kind of go back and forth really helps.
Best thing I like about it is the physical mentor and the guidance that they provide. It helps me a lot, and it's like a motivation. I feel like if I didn't have that, I don't know how far I'd be into my BSN right now.
I would like to be a nurse practitioner. I'm not sure in which area. Labor and delivery always kind of piqued my interest, but we'll see once I get out and start practicing more which avenue I want to take. And that's the beauty of it, is you get to choose where you want to go.
It is a huge commitment. It's like probably the biggest commitment I've ever made in my whole life, because you have to study. You have to find that time to study, and you can pretty much forget having a social life. So once you decide to choose nursing as your degree, then stick with it, because it's worth it. It'll be worth it for you.
I try to meet with my instructors to let them know that I care about my grades, and just to show that I'm active. And then I try to use the resources available to me on a daily basis.
You got to keep pushing. It's scary, it's tough, it's a lot of work, but if you have the drive and the determination, you're gonna do it. You're gonna get there. Just keep working at it. You're gonna have setbacks at times. It's not if it's gonna happen, it's when it's gonna happen and how you deal with it.
You can do it. Sometimes it gets overwhelming, and at the very beginning of it, it just seems like it does seem so overwhelming, but just take it day by day. Take it one step at a time, and you will get through it. And I think that's advice for any nursing student, because I think sometimes people go into nursing without realizing how much it really entails. I had no idea. When I first started nursing school, I told my mom, I'm practically going to be a doctor by the time I'm done, because I didn't know you had to know so much about just the human body, and as far as, on a cellular level, and then with everything. But so even though it seems overwhelming, it can be done. And so just, take it one day at a time.
I've gone through a lot to get here, and it's what I want. And so I'm not going to stop until I get there.